please. Thank you and thanks to all for joining us.
Thank you very much. I like to view some of the challenges with incentivizing academicians and institutions to recognize the contributions of sharing clinical trials data as an extension of the team science conversations that are going on across the country and across the world. So how do we come up with the appropriate ways to acknowledge contributions of investigators that are not the traditional PI or the first or last author on the publication? And how do we come about with determining the meaningful metrics and ways to track how the outcomes and the contributions of these people have added to our science and to the way we treat patients? And this really then extends into how we share data, and perhaps most importantly, how do we reduce barriers? And at the end of the day, it does usually boil down to time and money, investigator time, institution administrators' time, and the money that is necessary to be able to create these. So could you forward the slide? I don't think it's working. There it is. So first, if we consider the contributions and the metrics, I think it's been discussed in previous panels here that publications from the secondary analysis need to acknowledge who created the primary data sets. And yet that's a shared responsibility, and that we don't want to burden the primary clinical trialists with defending what they've done depending upon the interest level of the different groups that may be doing the secondary analysis. And leading into that, there has to be methods of resolving disputes, especially if this is a clinical trial that has led to a big change in the way we care for patients. How will we then deal with these secondary analyses and determine whether they have validity enough to change the way we practice? Secondary analysis have limitations. Most of the trials were not set to come with these determinations or outcomes. And then, of course, there's great value in combining these trials for hypothesis generating, and that's what we want to maintain and open. So how do we track the outcomes of secondary analysis? Do they add value or confusion? And who decides that? So in reducing barriers, I think consent issues are one of the primary concerns. Not only do we have to have consent issues within our trials, but with our hospital partners, so that when patients are admitted to hospitals, we are sometimes able to collect the data and share the data. And with admissions of patients that then end up going on to clinical trials, these are not always easy to obtain from our hospital partners, as well as all the other institutions that could be involved. There's data safety. While we have a lot of ways of putting data behind barriers, certainly the whole idea with the computer revolution and cloud computing, there are a lot of necessary safeties that have to be put in place. And then funding the effort required to share these protocols and the data. This takes a lot of time to be able to put the data in a format that is understandable, as well as responding to questions from groups that may want to do secondary analyses. Making data and protocols deliverables of trials, and that feeds back into the idea of actually funding the effort. How do we then design our trials? And this is a forward view. How do we design our trials so that we can have shared protocols and data available in a easier way of doing it than we currently have now? Because there have been multiple discussions of how retrofitting data for de-identification purposes has its challenges as well as costs. And then how do we create these data repositories? Universities are under many, many financial constraints, not only from clinical trials, but from a lot of other areas. How do we create data repositories so that the costs of keeping this data long after the trial has finished do not fall back onto the investigators and onto the universities? And if we do that, of course, then we relinquish control of the data, and then the role of the honest broker becomes very important. And how do we establish those rules for honest brokers for utilizing the data?